Today I'm going to talk a little bit about phobias. A phobia differs from a fear because a fear is often a passing sense of uncomfortableness, whereas a phobia is an overwhelming sense of dread and the thought that something horrible might happen. And this can take place when you see the feared object or you experience perhaps anticipating going into that particular situation. Because phobias can be simple and they can be social, they can be complex as well. A simple phobia is the fear of spiders, the fear of snakes, fear of dogs, that sort of thing. Social phobias will be agoraphobia, fear of going in open spaces. It can be claustrophobia as well, fear of enclosed spaces. And it's self-explanatory in terms of being in the social context and having that same sense of anxiety and dread. Complex phobias can be because one phobia has created another one. So for example, if you have emetophobia, which is the fear of being sick, you might end up with agoraphobia because you might not want to go out in case you see someone being sick or you feel sick yourself. So that's where the brain is an extremely complex part of our body, and these can be quite confusing ways it chooses to react. Phobias are originally thought to, at least simple ones, extend from evolution. It makes perfect sense that we are afraid of things that could have done us harm, such as snakes, spiders, perhaps big animals like lions and tigers. However, phobias can also be learnt. So for example, if we see our parents react to a certain object like a mouse or a spider or whatever it might be, a social situation, we ourselves might begin to imitate that behaviour and respond in the same way. It might even be that we learn a response to that phobia. So for example, if we drink something and then we feel sick, or it may not even be related to the drinking at all, it might be that we simply have food poisoning, we might associate the feeling sick with that particular drink, and that can cause avoidance of that drink. Phobias can be terribly debilitating because what they tend to do is they tend to mean we avoid those situations, and that can cut us off from quite a lot. So there are a few things that we can do about them, or at least try and do about them. One way is a technique called systematic desensitization. Systematic desensitization is slowly building up a tolerance for that feared object whilst concentrating on your breathing and calming your body down at each stage. So for example, if you're afraid of spiders, the first thing might be to think about a spider. And as your heart rate increases, you begin to focus on breathing deeply, breathing calmly. Maybe you use paired muscle relaxation when you clench and you release your muscles. And then the next stage, which will happen a little bit later, might be that you look at a picture of a spider and do the same thing. You go through the same process. Then a spider may be brought into the room, far away from you. And then the next stage might be it's brought closer to you and then you hold it. At each point during that journey, you are still focusing on your breathing, still focusing on keeping your body calm. Strangely enough, it may not even be just simply deep breathing that can help some people. There have been reports where people find that vigorous exercise, sort of running on the spot, can actually have a similar effect. So it may be worth thinking about that as well. Also, if you struggle with concentrating on your breathing, you might want to think of ways of getting outside your head, such as counting the second hands on a clock, an analog clock, or even counting bricks in a wall or the paving stones on the ground. Those are other ways of calming yourself down. It might even be that your phobia can be treated with rewards. So for example, if you are afraid of dogs, perhaps you have a lovely meal or something like that in a room where there are dogs, and so you begin to feel less afraid because you are not afraid of the food. Sometimes it might even be that it's due to an unconscious experience that you've had that you've forgotten about. Maybe you witnessed something traumatic and that hangover, that sense of dread that you experienced back then goes with you. In that case, it's sometimes better to be able to talk about it and finally try and identify the source of the fear, and that's when you can start taking other steps in order to manage it.